Hello, veterans, aka employees, everybody out in YouTube land. I thank you for being here, watching another video at Veteran Lane YouTube channel, where we talk about VA disability and educational platform. There's a lot of information out there. We will eventually get through all of it one day, I imagine. But the ultimate goal is to, well, make this process smoother between VA and veterans alike with the education. Now, veterans, keep in mind, it is an educational platform, so I don't advise here because I don't want wrong individuals to have your most private information by mistake. So give us a call, 480-219-2101 to set up a time to speak with us, or the best way really is to go to our webpage at veteranlang.com. Right there off our VA case evaluation button, you get straight to my calendar and schedule a phone call or an in-person, depending on what works best for you. Now, we do help veterans across the whole nation because we are VA accredited. We are able to do that. Veterans for your VA disability claims only. So check that out. Now, if we're not the ones that you want to work with, that's totally understandable. I want you to be comfortable with who you work with veterans. So understand you got VSOs, you got other VA accredited attorneys, and you got VA accredited agents out there. Look them up, see which one fits the best for you. But otherwise, if I've failed to mention it, I am your friendly VA accredited attorney, Matthew Lang, here with another topic. We're going to talk about flare-ups today. You know, this topic I really thought of recently because of my own flare-up issues on my own conditions here in the last couple of weeks. I think a lot of veterans can relate. The idea of a condition being worse one day and not so bad the next day is just something we live through. I feel that there are times where we can't even understand why the condition is worse on another day, or even for a week or 2 weeks or a month at a time. But myself, my own conditions really got me down over the last week, throughout last week, and really kind of healing up now and calming down for this week as I record this video. But I'm pretty sure when I got out of bed that morning, I looked like a baby elephant trying to walk for the first time. Nothing was working right. Knees were not holding weight. They were unstable. The back wasn't bending. Everything was going wrong. Veterans, I imagine you can relate to a lot of that. So that's one reason I want to talk about these flare-ups, because they're really crucial and important in the VA claim. Now, VA, for those of you who aren't veterans or maybe don't experience the conditions that the veterans do, understand flare-ups is a really huge thing that the law wants you to look at. They want you to find the evaluation for the worst possible day the veteran has. And of course, veterans, you got to remember, VA is doing that with just paper only. So we might be able to help them out with that. So let's get to understand this topic just a little bit more so that we can help each other out, both VA and veterans. So let's start with the basics. A flare-up. Well, a flare-up is a period when the disability becomes worse than it normally is. So, like you say, it's not uncommon for me to be able to get out of bed. Maybe a little bit of pain, but when it flared up, I was stumbling all over the place and trying to figure out how to dress myself that day. Those are examples of flare-ups. Conditions could just completely leave us in a situation that is just not normal at all. Now, can flare-ups happen in all conditions? I think so. I really think so. But what we're going to really talk about here, just to get the idea of what flare-ups is about, is probably more the back and the joint conditions. But understand, they can happen with migraines. They can happen with things like PTSD, fibromyalgia, maybe a GERD or another gastrointestinal disorder, skin conditions at that. These conditions aren't going to be the same thing every day. Some days are going to be better than others, likely. They may not be perfect, but they're going to be better than others. So many of these conditions aren't, again, constant. They're not going to be the same. And that's what we really want to express to the VA here, veterans, is we want them to understand that. They should understand they're not always the same, but they may not realize at what severity they're not the same. And that's where we get to help them out. So, again, during a flare-up, symptoms can become more severe. They can become more limiting. They can become more disabling than usual. VA does have to consider all this information. Those flare-ups could ultimately change your evaluation, veterans, to a higher evaluation than if you didn't have those those flare-ups. So all these requirements that we're going to talk about comes from the VA regulations. We're talking about the C.F.R, the 38 C.F.R, where it tells us the VA's got to consider functional loss due to pain, for example, when evaluating musculoskeletal disabilities, things like your joints, veterans, your back, your knees, hips, neck, shoulders, and so forth there. We also look towards other areas in the C.F.R. that says the VA's got to consider other factors affecting joints, including weakened movement, excess fatigability, incoordination, or just pain on movement, or what we know as painful motion. These regulations recognize that a disability is not just about the range of motion, even though that's what it may show in some, like the joints and stuff, but it's about the condition's actual limits, veterans, that you have on your functionability. Now, outside of the C.F.R. and other regulations here, the courts have really gone much further in explaining how flare-ups must be evaluated with a series of cases, really. And so we really want to highlight some of this stuff to the VA, because I know my time in the VA, it was not uncommon to hear, well, we don't use the case law, but the case law is what I just said, law. And you have to focus in on what the courts are saying too. You have to see how they're interpreting it in order to apply it correctly to your decisions, VA. This is no different really than the C.F.R. in my mind, or the United States Code, for example. It's just a further interpretation of all those. That's what the court is doing. So one of those important cases that I'm hinting to here is a case known as Sharp. Now, Sharp was around 2017. And Sharp is where the Court of Appeals for Veterans Claims, or CAVIC, had addressed a very common problem at the time. VA examiners were frequently stating they could not estimate functional loss during flare-ups because the exam was not conducted during a flare-up. And we still see this occasionally, even today. So they would say that I couldn't tell you without resorting to mere speculation, or some statement like that. Or they would literally say, well, I can't tell you because I'm not having a flare-up now. Well, the court in Sharp had provided a ruling that said that explanation is not sufficient by the examiner. They got to give more than just saying it would be speculation. Now, unfortunately, in my time with the VA, it was experienced that if the examiner said speculation, we just kind of moved on and we said, well, there's no flare-up numbers, and that's not the proper interpretation. The proper interpretation is looking at it and going, did that examiner attempt to estimate the additional functional loss during the flare-ups based on a series of things? Say, for example, the veteran's description of symptoms, medical history, the examiner's medical knowledge. Are we really lined up with the medical community at large? That's really the question here. Is there something else that could have helped that examiner provide that estimate without resorting to mere speculation? Another piece of evidence, let's say. These are things that have to be addressed. And that's what the court was saying, is we're not going to give you a pass on just saying, I can't do it. Well, why not? Did you consider all the evidence? Did you consider all things in the record? Explain your reasoning. Provide us a rationale to your opinion there, examiners. So the court made it very clear that the examiners cannot, again, simply just avoid the issue because the veteran wasn't actively having a flare-up. So that was very crucial of a case in 2017, helping veterans with the flare-ups. Now, we can go back even further. The 1995 case of DeLuca even had an impact in the functional impairment and functional loss for veterans' disabilities. DeLuca had held that VA examinations must consider functional loss caused by pain and flare-ups. So it was already really there in that court's ruling. Of course, we had to go and have other courts explain it more and break it down some more. But it was there. It was not just a mechanical measurement of just the joint motion, like the C.F.R. appears to be on the surface when you look at just the diagnostic code. You've got to look at the whole C.F.R. This case ultimately reinforced the idea that disability ratings must account for real-world functional limitations, particularly when symptoms were worsened during use or flare-ups. So veterans, this is really leading into some of the reasons to why when you go to these VA examinations and the examiner is not just doing range of motion testing once, but another 3 times, and are supposed to be asking you all these series of questions to get a feel for, well, what if you were having your worst day? If that's not today, what does that look like? Now, another case, a third huge case in the whole mix, was Mitchell around 2011. Now, Mitchell is where the court explained that pain itself can cause this functional loss, and VA examiners must evaluate how pain actually limits motion and function. So again, they're really talking about those flare-ups again. All these cases in some way talked about that functional loss and flare-up. The court emphasized that the VA must determine whether pain limits the veteran's ability to perform normal movements of the body. So we started seeing that explanation have to be put into the VA exams. And again, this analysis often became especially important during the flare-ups because the flare-ups is usually where the pain would increase, right? And the limited emotion would become even more limited. That's what the court was really trying to get out of there. Look, flare-ups are a huge issue. The worst day the veteran is having is what we're really trying to gather here. So let's try a little exercise here so we can hopefully understand it just a little bit more. So veterans, imagine if you can, in VA, kind of imagine the same thing except from the veteran's perspective here. Imagine a veteran with a service-connected lumbar spine condition. So during a VA examination, the veteran may be able to, say, bend forward 60 degrees, right? So VA, you're going to see that in the DBQs, right? You see that checkbox, and I know you're going to see that checkbox, and you're going to go click over here in 60 degrees. Okay, that's a good start. Under the rating schedule of 38 C.F.R. 4.71a, that measurement might support that 20% rating. But yet we have to look again. During the exam, the veteran is going to report flare-ups in this example here. Pain becomes more severe, movements extremely limited. Perhaps it's deemed that during a flare-up that the forward flexion may drop to 30 degrees or less. Now, when we're underneath the same regulation, where it would have been 60 degrees, a flare-up might put it more towards a 40% rating, let's say. Well, and that's where now the VA's got to understand that worst-case scenario based upon the medical evidence in the VA exam and say, oh, let me erase this box over here. This is more where you lie here, veterans, in the higher evaluation. So if the examiner ignores the flare-ups, the veteran may receive a lower rating than the law allows, and that's what the courts were really getting at here as they interpreted the law. We wanted to make sure the veteran was receiving the full benefit they were allowed and they deserved on the worst possible day. What's the worst flare-up possibly look like? So, veterans, this is why your testimony about flare-ups is really important. This is why it's so important. So under VA law, veterans, you are considered competent to report observable symptoms. VA, they are competent to report symptoms. I'm only highlighting that because I, again, see the bad and ugly, and I see how VA, you will attempt to dismiss it or not even address it at all. So please remember, the veterans are competent to report their observable symptoms. This includes the pain. This includes the limitation of motion. This includes the frequency of the flare-ups. This includes severity of episodes, and how long they last, and every detail you possibly think of that would fit this flare-up scenario here. So, veterans, your description ultimately is what we're looking at here. Your description can help the examiner and the VA estimate or understand at least the functional loss during the flare-ups as required by, well, the law, including the court's opinions. So this is where veterans, I would say maybe you want to consider this. Now, this is an advice. I don't know the facts of your case, but it's something to think about when you apply it to the facts of your case. Is it something you need to do? If it is, great. If not, that could be great too. But something you might want to do is first describe flare-ups clearly during your VA examination. How often do they occur? How long do they last? What triggers them if you know? And what activities become difficult or impossible? My example was I didn't know what triggered it, and I couldn't get out of bed, or it was very difficult to dress myself that morning. That would be an idea of a description of a flare-up. Now, I would say second, you want to document those flare-ups. Document them if possible. Keep a simple log. showing when episodes occur and how often they affect your daily life, veterans. Paint that picture. Paint that picture, because all VA's got in front of them is just documents. They don't have you to ask all these questions to. Now, the VA examiner should be, but they may not either. Now, third, I would say make sure flare-ups are discussed in your medical treatment records, veterans. If you're having a really bad day and you go in for some treatment for your primary care physician, it may not hurt to let them know and make sure that they document how bad that flare-up is and record that correctly and utilize that in your VA claim there. Medical documentation for sure can strengthen your claim and help support the severity of your condition as well, veterans. So just remember, you got a couple ways of doing this. Your own statements, medical documentation, both can be helpful. So ultimately here, I would say our key takeaway is this, veterans and VA. It's that veterans, your disability rating should reflect how your condition actually affects you, including during flare-ups. And VA, those evaluations that you assign to the veterans should reflect their condition, again, actually how it affects them, their worst day, especially during flare-ups. The law includes all this information in the C.F.R., in the court cases like we talked about, DeLuca, Sharp, Mitchell. They all require the VA to consider these periods of increased disability. So if flare-ups significantly limit a veteran's ability to function, they may support a higher disability rating off that limitation. Well, I thank you everybody for sitting through this video here. I just wanted to express the importance of the flare-up, and it really came to, like I said, my mind as my own issues flared up just out of the blue, and probably worse than they normally have. But it reminded me that not every day is the same. The levels of pain, the functionability of every day with any of these conditions that veterans have is not the same. Now we focus mainly on the joints here, but we can really probably apply a lot of this to the other conditions like PTSD and migraines, GERD, for example. We mentioned skin conditions as well, and so many others. So just because these fit just the musculoskeletal, and that was what was used in my talk today, doesn't mean the law is ignoring all the others. We still have flare-ups with other conditions that the law addresses as well. We might be able to even utilize these laws in some aspect from a legal argument as well. With that, I hope you did find this video helpful. If you did and you haven't subscribed to the channel yet, please do. We're going to work on improving the channel even more so than where it is right now. Working to do that as I learn more about some of those changes that we need to make here to make these videos even that much better. But we're going to continue talking about VA disability law either way. So if you do have anything you want to talk about, any topics that isn't overly personal, because I don't want to put, again, veterans, all your personal information in a spot where somebody can grab it that shouldn't have it, feel free to throw those in the comments. Let us know what you want to talk about here. I'll do my best to put together a video, and I'll share my knowledge with you and my point of views of all that, and we can even discuss it further. It's all about teaching each other. I'll learn from you, and you learn from me, and we all learn from everybody in the end. We don't want to stop learning, because if we stop learning, this process will never get smoother. It'll probably only get worse, in my professional opinion. But let's keep learning. Let's keep learning. As always, veterans, thank you for your service, and dedicated VA employees, for those who are doing so much for veterans and trying to do it right. We thank you for what you do as well in that support of the veterans. And until next Tuesday, catch me in a couple of short videos here along the way. But otherwise, have a wonderful week, and I'll see you then.